Welcome to University Hospitals of Morecambe Bay NHS Foundation Trust. Our hospitals are important to everyone who lives across Morecambe Bay. Over the next few years, the way we provide services is going to change to ensure we can deliver 21st century healthcare to a consistently high standard that we can afford. We have a number of challenges, but our priority will always be to provide safe, high-quality care. We have 5 sites spread across a wide area. We serve a population of about 365,000 people. Other hospital trusts often provide services to a similar number of people, but from perhaps just 1 or 2 sites. That means our costs are higher. But we don't get any more money because we're funded for the patients we treat, not the services we need to provide. It's great that people are living longer, but it means there are increasing numbers of people with long-term conditions such as heart disease, diabetes and hypertension. The demands on health services will therefore continue to grow, and we have to find ways of meeting those demands. Sometimes there are not enough services provided in the community. That means many more people across Morecambe Bay are being admitted to hospital unnecessarily and are staying in hospital longer than they need to. In recent years, our services have also been criticised by NHS inspectors. Our hospitals have sometimes let patients and their families down. Improving the quality and safety of our healthcare is therefore vitally important. Many improvements have already been made. For example, in the last 3 years, in addition to replacing staff that have left, we've also taken on around 25 more doctors, 71 more registered nurses and 11 more registered midwives. It's a picture which is constantly improving. We're now in the process of investing another £3 million on frontline staff. We're seeing patient satisfaction levels rising, as well as quality standards getting much better in many areas. For example, in 2014, 9 out of 10 of our patients said they were likely to recommend our services to friends and family. But we still need to do more. We have a highly dedicated, professional and loyal workforce, and our people are the key to continually improving quality and safety in our hospitals. We've launched Listening into Action, which gives staff a voice, providing them with the power and support to make the improvements they know will help to deliver better care for their patients. As a result of the extra costs involved in improving our services, increasing demand for these services and our geography, we also have a big financial challenge. We're spending about £25 to £30 million more than we receive every year. If we do nothing, that gap is expected to go on rising. We need to change the way our hospitals work so we can reduce our costs while continuing to invest in the new services and equipment we will need to ensure we do not fall behind other parts of the country. We're working hard to make our services more efficient, but that won't be enough. That's why local NHS organisations have worked together to develop the clinically led Better Care Together strategy. The aim is to change the way local health services are provided, so we can deliver high-quality services inside and outside hospital, which we will be able to afford. Over the next few years, we want more people to be treated in the community, closer to where they live. Community health facilities will be improved and health professionals will travel to locations which are more convenient for patients. We will make better use of technology to improve the links between GPs and hospitals, so that more people can get the treatment they need without going into hospital. As more people are treated in the community over the next few years, we'll be able to focus on improving the quality of care for the people who need to come into hospital. Whilst we won't need as many staff working in our hospitals, we will need staff to work in the community. We're not planning any compulsory redundancies. We expect any reduction to be met by staff who retire or leave the hospital, and by reducing the number of agency staff. We will continue to provide accident and emergency services and consultant-led maternity services at both Lancaster and Barrow. Our 2 smaller community locations in Ulverston and Morecambe will also continue to play an important role. Westmoreland General in Kendal will continue to have a key role, including the Helm Chase Maternity Unit, and providing chemotherapy, radiology and dialysis. We will also need to invest money to improve our hospitals to make them fit for 21st century healthcare. We want to make our hospitals great places to be cared for and great places to work. This has been just a brief overview of our plans. You can find out more by visiting the website. There are posters with more details in each of our hospitals, where you can also pick up a copy of our newsletter with a summary of our future plans.